suffer from TB have a sigh of relief because the disease is now fully recognized as a special day by the WHO. And 24th of March every year is commemoration of this tuberculosis. In Borno State, in particular, His Excellency the Executive Governor, Professor Babagana Omara Zulum, has MNI, has provided enabling environment not only for us as staff, not only for us in the healthcare sector, but he's also provided the enabling environment for partners who are now in Borno State, who are now providing services for the entire people of the state. Now, because of uniqueness of Borno State, last year we were not able to capture the expected 16,000 people with suspected tuberculosis. Instead, we zoomed on only 5,000 on average, and that is because of the situation of insurgency, B, because people have been displaced and therefore they could not go to those respective areas, and C, because some of our healthcare facilities, as a matter of fact, up to 45% of our health institutions in Borno State were destroyed, bombed, deleted, annihilated by the insurgency. And therefore, the human resources available to treat people for all sorts of diseases, including tuberculosis, were not there. Some were actually abducted or killed, and some have suffered from post-traumatic stress disorder. So that has also, the diagnosis and treatment of our patients in Borno State. However, with the current approach by His Excellency Professor Babagana Omara Zulum, where the security situation in Borno State has now greatly improved, where he's rebuilt and reconstructed so many healthcare facilities. People are now able to reach out to us and are able to come to us for with their symptoms, which in cases like if they happen to be tuberculosis, then they can get the appropriate treatment. His Excellency has provided funds where our partners are not able to do so. The state government is providing the funds to acquire the necessary drugs and medications which can treat patients who have tuberculosis. You have seen today a clear demonstration in only one facility in Gwange here in Maiduguri, where we had over nearly 350 children within a year who have had tuberculosis. Some of them have got complications which we have not spoken, because in surgery we do see children with perforated bowel. So it's not just stops from coughing and sneezing like that. No, sometimes, especially in children who are not able to communicate their symptoms, then we end up picking up the burden on the operation table, etc. So these are the reasons, as you asked, and we're doing our level best to ensure that there's contact tracing of all those people, and then they will be counseled and provided, with appropriate treatment. Let me use this media, the people of Borno State, appeal to them. Please bring your children for vaccination, especially tuberculosis. It's very important because you only need one tuberculosis injection for the whole life. So therefore, you only once, and that's it. And in fact, even in developed countries like United Kingdom, tuberculosis is now resurging again because they stopped doing the immunization against TB. And youngsters, adolescents are presenting with tuberculosis even in the United Kingdom. So therefore, it's important that our dear people of Borno State, please use this opportunity to understand that tuberculosis can be completely prevented, and it's only one injection, and this injection has been in existence for many years, and therefore, please bring your children to have the vaccine. Yes, thank you very much. Our partners have been very gracious, and we mentioned one of them, WHO. I've also mentioned Global Fund. I've also mentioned UNICEF and also USID. These are people or partners who have been helping us, some of them providing the drugs, some of them providing the training and capacity building for our healthcare workers, which is retraining and retraining so that we become very efficient in the diagnosis as well as management of tuberculosis within the state. So we also have, for example, advocated by the WHO, refuse the use of gene extracts in terms of confirming the diagnosis of tuberculosis.
Lastly, sir, do you have a target of 5,000
We want to treat all of them. We want to reach out through your assistance, the media. We're now appealing for those who have chronic cough, who have lost weight, and those whose relatives have been diagnosed with tuberculosis. So please come forward. There is no any cost implications for them. The treatment is diagnosis and treatment of tuberculosis entirely free, and therefore you can come forward, and this will start in your local government. We have 27 local governments in Borno State, and in each local government there are program managers of tuberculosis, and therefore if you approach our facilities, you can be able to make the diagnosis and start treatment even at local government level, because we are getting all the feedback from our local governments. We can see what is happening, and we can advise them, and we're spot checking on them. That's why recently we had a training of all the program managers and deputies here in Maiduguri to make sure we are all on the same page, and that the new directive, the new marching order by His Excellency, to see that His Excellency, the Executive Governor of Borno State, Professor Babagana Obanazulu, to see that this scourge of tuberculosis is reduced to the barest minimum, barest tolerable minimum, in fact, to eradicate tuberculosis in Borno State.
Thank you.